and get started. And I think I'm ready. Go ahead when you're ready, Danny.
Sure. Thank you, Jeremiah. And thank you, everyone, for joining. As Jeremiah said, my name is Danny, Danny Samudio. I am with CVS Caremark. So my role within CVS is I'm the account manager for City of Detroit. So I work with Jeremiah and the rest of the team to help manage the plan. Um, so we'll jump right in. So if you haven't not heard of CVS Caremark, you've probably heard of CVS Pharmacy or Minute Clinic. Um, so we are all under the same umbrella of CVS Health. Um, CVS Pharmacy, obviously brick and mortar pharmacies where you can go locally to get your prescriptions, and the Minute Clinic, really convenient clinics where they offer walk-in appointments where you can see a nurse practitioner and they can write your prescriptions. We also have some of those locations that are also health hubs, and they offer some additional services available for you to utilize. So CVS Caremark's primary focus is to manage your benefits, similar to your health insurance or your medical insurance. We do the same, but for your prescription coverage. So we partner with the City of Detroit to determine what medications are covered, the cost, and where the prescription can be filled, and and then we help manage and administer those benefits. Um, Also, our focus our focus is to help provide you the tools and services that you need to help you manage your health and your medications. All right. And to do that, we have several tools available for you to use to help you, as I said, manage your health and your prescriptions. Um, One of those, is the CVS Caremark app. And the CVS Caremark website. So on on the app and the website, once you log in with your information, you are able to review it. It's personalized to your coverage through City of Detroit. So you're able to review your plan details. Um, there is a price tool available on there. So if your doctor writes you a new prescription, um, once you log in, you just type in the name of the medication. It will give you the exact cost. Um, I find this really useful, especially sometimes you go to the pharmacy and you're a little bit shocked with the price, and the doctors are not aware of usually not aware of the costs. So it is a really nice option to be able to have that information before you go to the pharmacy, or sometimes you can even pull it up while you're with your doctor and um, kind of discuss the cost and see if there's other options if it's too expensive. Also, through the app and this website, uh, you are able to find any in-network pharmacy. So that include that's not just limited to CVS pharmacy. So um, that's going to pull up any in-network pharmacy that you're able to go and fill your prescriptions. Through the app and the site, you're also able to manage and order any mail order prescriptions. So the mail order prescriptions are either you or your doctor send in the prescription, and that is sent to our mail order pharmacy, which then fills it for you, and we mail it out directly to your door, which is really nice, especially if it's something that you take, that you're going to be taking long term. You get your 3 months prescription right to your door. And then some of the other tools on there is you can keep track of your spending. So through the city of Detroit, your plan does have a maximum out of pocket. So for that amount, once you do reach that amount after, there is no cost to you once you meet that amount. So it is a nice option to know where you're at all times. And that also through the app and site, you can set reminders, alerts that will notify you when you're ready to fill or you do need a new prescription. And then also you're able to set up automatic refill through that portal or website or app, I apologize, which is nice. So automatically refill your prescription and then just notify you once it is ready to be picked up. All right, so registering at caremark.com. So this is similar to, this is the same as the Caremark app. So if you already have coverage with Caremark or City of Detroit, but you have not utilized either of these, you do need your member ID card or member ID number, which is on your member ID card from Caremark. So you would use that to register and sign up for this website, create your login. Once you do, you are able to log in and see all your benefits through your prescription plan. And like I said before, you can use any of the tools available to you. And if you are new to the plan or don't have coverage through the plan yet, you can register on or after your employment date. So once your coverage is set up, then you are able to go on and register. So as far as the plan is the same as far as your co-payments, maximum out of pocket. So under the plan, generics are $10, and that's for a 30-day supply or up to 34-day supply. So that's if it's a new prescription, whether it's a one-time thing antibiotic or pain medication, if it's generic, $10, brand name 20, and non-preferred 35. Now the plan does also have it's called Prudent RX. So it is an option if you do fill a specialty medication, which most people do know what a specialty is due to the cost. These specialty medications treat kind of rare conditions, and the cost of those medications is usually pretty high. So with this plan, if you are enrolled in the plan, you would receive I believe it's either a phone call or a letter from Prudent RX asking you to enroll. So if you are new to filling a specialty, make sure you watch out for that communication. It's not just spam. But once you are enrolled, you do receive that specialty medication at no cost to you, which which is great, even if your copays are only $20 or $35. It's nice to save that money, but make sure you do watch out for that communication if you are filling a specialty medication. And then with the plan, you also have the plan also has the CVS maintenance choice, 90-day option or mail order benefits. So with this, this is for medications that you take on a daily long-term medication. So blood pressure, cholesterol, your any diabetes medication, stuff that you're on daily long-term. You'll want to fill 90 days supply at a time. And you could do that through those. Those do need to be filled at a CVS pharmacy or at our mail order facility, but you do save quite a bit of money. So for 90 days, so you get the generic 90-day prescriptions for $10, preferred brands 20, and non-preferred brands 35. And as I mentioned, I believe I mentioned out of pocket, maximum out of pocket. So the plan does have a maximum out of pocket. So for an individual is 6,350 and family 12,700. So once that amount is met, then all of your prescriptions would be covered at 100%. All right. Now, I know I went over quite a bit and threw out some terms. So these terms will be available, as Jeremiah stated, that the presentation will be posted. So, but I will go over some of them. So copay, coinsurance. So that's the amount, the most amount, like the most you will pay for your medications. For example, the generic 30-day, $10, or the 90-day, $10 as well. Maximum out of pocket, that's the maximum that you would pay. And then after that, you are covered at 100%. So generic medication, so this one is an important one because it'll save you money. So generic medications have the same ingredients as the brand name, but usually they do have a lower copay. So in your case, a $10 copay for up to 90-day for those maintenance medications. Brand and non-preferred brand, those are the higher cost medications. So if you are at your doctor's office, like I said, you can look up that cost on the Caremark.com app or website and have that discussion with your doctor. See if there's a generic available, and that'll save you some money. Maintenance medication, those daily long-term medications that you're on. So blood pressure, diabetes, cholesterol, in the acute short-term. So like antibiotics, pain medication, something that you are on short-term. Those medications you can fill at any in-network pharmacy. So if you're close to a Walmart pharmacy, you can run in there and get your prescriptions. And like I said, again, going back to the caremark.com site and app, you are able to locate those on there and see what's closest to you in network, which is almost every pharmacy is available in network to fill these acute prescriptions. All right, some other kind of important terms. So quantity limit and quantity limit, there's a limit on the amount of medication that you can get, either as far as a daily dose or how many tablets every 90 days or 30 days. So the plan does cover 90-day prescriptions. So all of your prescriptions, they cover 30 days or 90 days. So for most medications, that's perfect. Like you can get your 3-month supply and be set for a while. This typically does apply for some pain medications where um, there is usually a limit on how much you are able to take on a daily basis. But if you do have questions on those, you also can visit the caremark.com app or website. Step therapy, there are some drugs that do require um, for you to try usually preferred options before you can, or generic before you can fill that medication. Prior authorization, this one is a very important one. Some medications do require a prior authorization. So for those, your doctor would reach out to us, or the pharmacy would reach out to the doctor, let them know that your prescription does require a prior authorization. They then would reach out to us and provide any documentation needed. And then we have pharmacists that would review that and ensure that this is the most adequate prescription for your condition. And the PA team, or the prior authorization team, would then work with your doctor, whether it's approved or not, and notify them of what's available as preferred or in the formulary, and then work with them to get you your prescription needed. Appeals, so similar to the prior authorization, if your initial prior authorization is denied, you always have the option to appeal, which is a secondary review that is done, which is always the option. So if you do get a prior authorization denied, make sure you do go through the appeals process. And that, again, is another review that is done to, our PA team works with your doctor to review all of the medical history and ensure, as I said before, that this medication is appropriate. And any additional information on prior authorizations and appeals, formulary as well, can all be found on the caremark.com site or the app. Under plan documents, you'll be able to find all that information. So earlier I mentioned the maintenance care plan option or benefit. So with that, you are able to fill your 90-day prescriptions at CVS or CVS mail order. And that mail order option you are able to set up through your member portal on Caremark.com or the app. Now, one plan option that is recent addition to the plan is no cost vaccinations to you. So any flu or seasonal vaccinations, so flu, COVID, they are covered under your prescription plan now. And that is already in effect. So you can go to any location that is in network. So CVS, Walmart, whatever you find it in network, you would go to the pharmacy just let them know that you want a flu vaccine, and they would administer it. It's a really nice option. You don't have to wait for your doctor's office. Set up an appointment and then wait in the waiting room. You can just walk right up and get that. Typically, they have you out within 10, 15 minutes at most. But that is a nice coverage that is available under your plan now through your prescription plan. All right. So again, I'd like to thank everyone for joining. I believe I am sticking around for any questions. Now I'll pass it on to Jeremiah.